My final research presentation is about the effectiveness of 3 different interventions on musculoskeletal pain in healthy sedentary office workers. Musculoskeletal pain is very common among office workers. A study with 1,185 eligible participants answered a questionnaire about their musculoskeletal symptoms in 9 body regions during the previous 12 months. They also had their participants specify what they thought were the causes of those musculoskeletal symptoms. For example, due to work, sports that they participate in, any hobbies that they have, housework, or other causes. They found that the annual prevalence of musculoskeletal symptoms attributed to office work was 63%. Based on the responses from the participants, the head and neck, low back, upper back, wrist and hands, and shoulders were the body regions reported to have the most musculoskeletal pain. Office work usually involves completing day-to-day tasks at a desk. Some examples of these day-to-day tasks are making phone calls, answering phone calls, writing and sending out emails, and typing out documents. Office work requires individuals to remain in a seated position for long periods of time. Many of these office workers do not maintain a proper posture while seated. This can later become a problem because it can lead to an increase in musculoskeletal pain, bone and joint malalignment, and increased ligament stress. Although studies examining posture exercise training, ergonomic education, and posture exercise training combined with ergonomic education and their effects on musculoskeletal pain exist, the exercise interventions mainly consist of stretching exercises. There is still need for research on the effectiveness of these interventions on reducing musculoskeletal pain in office workers that include stretching and strengthening exercise. I feel that it may be possible to avoid or reduce the occurrence of these problems by educating office workers about proper office ergonomics and by discussing the importance of incorporating stretching and strengthening exercise to maintain proper posture while completing office work. These are some examples of improper and proper sitting posture. The 3 photos on the left are all examples of improper sitting posture. As you can see, they are all hunched forward, their necks are not in line with their torso, backs are not being supported, their thighs are not parallel to the floor, their arms are not being supported, and their feet are not in correct placement. However, the photo on the right side shows the proper sitting posture. You can see that the back and arms are supported, thighs are parallel to the floor, shoulders are relaxed, neck is roughly aligned with their torso, and feet are in correct placement. The purpose of this study is to evaluate the effectiveness of posture exercise training, ergonomic education, and posture exercise training in combination with ergonomic education on reducing musculoskeletal pain in healthy, sedentary office workers. This study will last a total of 12 weeks. Ideally, there will be 160 healthy, sedentary participants in this study. These participants must already be experiencing neck, shoulder, upper back, middle back, or lower back pain, or a combination. They must work in an office setting for at least 30 hours per week. It is important that none of the participants have had any previous surgeries or injuries to the neck, back, and upper extremities within the past year. In addition, the participants must not currently participate nor have previously participated in any physical activity for at least the past 3 months. Individuals will not be included in this study if they do not meet the criteria. The participants will be randomly assigned to one of the 4 different groups. The 4 groups are a posture exercise training group, ergonomic education group, posture exercise training and ergonomic education combination group, and a control group. The posture exercise training and ergonomic education combination group will participate in both interventions, and the control group will continue their usual workday without participating in any interventions. Demographic data and baseline measurements will be collected from the participants. The posture exercise training group will participate in a 12-week exercise program that will include both stretching and strengthening exercises. For the stretches, they will be told to perform the stretch in a slow and controlled manner until mild discomfort is felt. Since the participants will be sedentary individuals, a familiarization session will take place before beginning the program. That way they get an understanding of how the exercises need to be performed. For this session, only one set of 10 repetitions will be performed for each exercise. For the 12-week program, the participants will perform the exercises 3 days out of the week. Each session will last about 30 minutes, and they will perform 3 sets of 10 repetitions or 3 sets of 30-second holds, depending on the exercise given, with a 60-second rest between sets. The ergonomic education group will receive a visit from an occupational safety and health specialist to modify their workstation using the Occupational Safety and Health Administration or OSHA workstation checklist. This checklist can be found on the OSHA website and covers the assessment of their workstations, seating, keyboard or input device, monitor, mobile devices, accessories, and general concepts. I will provide a link to this checklist at the end of this presentation. They will also attend a one-time 60-minute presentation that will provide them with additional knowledge and will discuss the importance of proper office ergonomics. Within the 60 minutes, the OSHA representative will discuss good working positions. The photos shown are examples of good working positions. Head is level, forward-facing, and in line with the torso. Hands, wrists, and forearms are roughly parallel to the floor. Shoulders are relaxed. Elbows are close to the body and are bent between 90 and 120 degrees. Feet are flat on the floor. Back is fully supported. Thighs and hips are supported, and knees are at about the same height as the hips. A numerical rating scale will be used to assess pain levels at baseline and at the 12-week mark when the interventions are complete. This scale is widely used in clinical settings, is great for measuring pain intensity, and is an important tool to assess the effectiveness of pain treatment. This photo is an example of a numerical rating scale. The participants will indicate their current pain level in the specified regions on a 10-point scale, with 0 meaning no pain at all and 10 meaning unbearable pain. The neck, shoulders, upper back, middle back, and lower back are the regions of the body that will be assessed. Once all information is gathered, data will then be analyzed. It is hypothesized that the combination of posture exercise training and ergonomic education will most effectively reduce musculoskeletal pain in healthy, sedentary office workers. The findings may be useful in a rehabilitation setting by physical therapists and occupational therapists. Instead of specifically focusing on just stretching or strengthening exercises when working with a patient experiencing musculoskeletal pain from office work, it may be helpful to also educate them on proper office ergonomics. In terms of avoiding or reducing the occurrence of musculoskeletal pain, incorporating both of these interventions as much as possible may be used as a preventative measure of musculoskeletal pain.